Okay, so today we are looking at, this is going to be day 5, chapter 8 of the Senior Fitness Manual. And so the Senior Manual kind of breaks it all down as like one big PowerPoint. Like you'll notice if you go to that manual, it does basically all of the movement prep in kind of one big chunk. So we're going to be breaking all 3 of those down. Looking at core exercises, balance exercises, and reactive exercises. You'll notice it does say like training for fall prevention. That is sort of like our main key concept when working with older adults. Like we're really trying to work on, you know, kind of like we talked about, when we were in the special populations class. We talked about not fall prevention being the biggest thing actually, but walking, like the ability to keep like up on your feet and just keep walking into your old age. That was like a really big deal. So we're kind of looking at a similar concept here. We really just want to keep our older senior clients upright. So as we're looking at it, right, we do know that like we can use, obviously core training has a lot to do with like keeping you upright. Balance training is going to be huge to prevent falls. And then we are also going to be looking at reactive training, which when I say reactive training, a lot of times people are like, oh, no way are you going to do, you know, squat jumps and box jumps and things like that with senior clients. But I mean, if my senior client like can do it without any movement compensation, I absolutely will. We actually really like jumping exercises with seniors because they are all about reaction, right? Like this is why, I mean, you could say reactive, you can say plyometric, they both mean exactly the same thing, but I really like to use the term reactive because it really is all about like your body reacting to something at super fast speed, right? Like lightning fast reactions. So that's definitely something we are also going to be looking at. So our objectives for today are to get into understanding the rationale for like writing programs that are effective for fall prevention, understanding how to implement core, balance, and reactive training, safely progress our clients through those, and then how to perform those exercises, like what makes each of those different versions different from each of the individual levels. Cool. Okay, so looking at falls, right? Falling is obviously a very serious risk for, I mean, it's a serious risk for anybody, you know. I mean, like even as your standard adult, you know, you could get hurt, you know, tripping and falling. But we do know that it becomes a really big deal as we get older, mostly because of all those physiologic changes that we have talked about in the past, right? Like as we get older, we know that like we often see like a loss of bone density. We know that like frailty is much more common, like it's easier to bruise. And so what we're going to see is that, you know, I'm trying to remember what year this was in. I cannot remember. Hold on one second. Fall prevention. Accidental falls. What year? 2004. So in 2004, we were seeing 1.8 million emergency room visits from senior clients due to like falls. You know, 16,000 deaths in 2005 are related to falling. 1/3 of adults are going to experience some type of like preventable fall every single year, which is a pretty freaking high amount. And then what we will often see, and the really big deal here is, and this is, I'd say, sort of the main takeaway sort of statistic here, 1/4 of people within 1 calendar year of sustaining a hip injury due to a fall will pass away. So that is a super high amount. So we see 1/4 of people who experience some type of like hip fracture will often pass away within 1 year. So here's the thing, when we say that, right, when we look at like what we're talking about there, we got to wonder why, right? Like why is a hip injury so detrimental to our senior clients? And it's not so much that the hip is anything special. I mean, don't get me wrong, like your hip joint is part of this giant bone of a femur, the longest bone in your body. But it's not so much that the hip is like causing death, but it is such a painful injury, and it is right at the base of like your lumbopelvic hip complex. So it becomes really, really difficult to get back on your feet and walk. And so what you end up seeing is just a massive increase in sedentary lifestyle. And so that decreased activity, increase in sedentary behavior ends up putting you in the ground. I mean, like it ends up just being this incredibly dangerous thing. We know that like a sedentary lifestyle leads to all of these comorbidities, right? We see obesity, we see heart disease, we see diabetes, all of those things. And so it's not so much the injury, it's the lack of movement. We see a decrease in the cardiorespiratory system. And so that's always an interesting statistic, and that's one of the reasons why like I'm constantly. My mom has these freaking. Oh, there we go. It was on the next. It's on the next slide. I had the year. My mom has chickens, and she loves them. My mom loves her freaking chickens, and I hate them. I hate those 7 little fall hazards that she's got running around the yard. And I always tell her, I'm like, the minute one of those chickens gets under your foot and falls, like I'm flying to Oregon and we are having chicken dinner. Like it's over. But that's definitely like a thing that we see, right? So that's one of the biggest reasons why core and balance and reactive training is so important to your client. Because again, like looking at the idea of reactive training, right? Which is that big explosive stuff, right? A lot of people think of plyometrics and reactives, and they think about like jumping as high as you can. And I love that. I think that's great. I think that like if you're an athlete, you want to like train to like jump higher. That's a super worthy cause, and I'm a big fan. But when I say that I would do reactive training with like a senior client, sometimes people will look at me and they're like, "Oh, that's a little weird, right? Why would you do reactive training with a senior client?" And it's like, well, because here's what reactive training really is when you break it down. And I actually don't have any way of demoing. I usually do this bit in class, but I have nothing in my room that will allow me to do it actually. Well, okay. So one of the, like what I like, the reason we call it reactive training is it is all about like how you react to something. So let's say you're walking along and you trip on something, right? And you have to like snap your leg through and then land without like falling all the way to the ground. So when you look at that like zoom in slow motion, right? And you kind of zoom in and slow everything down and really break down what is actually happening during like a trip or during a fall, is like you are going through the, like you're falling, right? And then your ankle is going to go into plantar flexion. And the second it makes contact with the ground, it's going to do all of the landing mechanics that are associated with our body, right? It's going to tighten up the foot, the calf, the anterior tibialis. It's going to create a bunch of isometric contractions there in order to help stabilize the entire foot and ankle complex. Your hamstrings and your quads are both going to contract to isometrically stabilize the knee, your adductors and IT band as well. Then it'll travel up to your hip, your core. Everything is going to respond immediately. And then, you're going to eccentrically decelerate a little bit, and then you're going to concentrically like come back up, right? So like that is a lot of stuff that's going on every time we jump and learn how to do that. That's why we call it reactive training. You are literally training to get better at reacting to ground forces, like ground impact. So we love that. We love to train. I love training my senior clients, if I can, with some version of reactive training. Now, it's not always the most intense thing in the world. Sometimes it's something, as simple as starting with just like a step up, which is totally not reactive. A step up is really much more of like a balance exercise, but they do have to deal with that little bit of impact every time they go down. And so they get a little bit of like foot and ankle like proprioception there. And then I love to do like little tiny like box jump downs with my senior clients. I think that's a really fun thing to train for, as long as your client can do it. Now, obviously, I've spent a lot of time lobbying towards why it's a good thing. We kind of got to look at it from the other perspective as well. We never want to do anything that our client cannot do with proper posture and correct execution. So if you notice that, like, you know, they don't have full range of motion in their ankle complex, well, that means that they're going to land, you know, in a dorsiflex position, or maybe they're going to stay in a plantarflex position. You know, if they don't have proper mobility there, it's going to be a hard impact, and that's definitely something we also want to avoid. So it definitely does go both ways. I think that, like, it is totally fair to be cautious about ever doing reactive training with senior clients, but I also think it's just as fair to say that, like, if your client can qualify and can effectively do reactive training, it's a balanced part of any workout program. Hopefully that sales pitch kind of convinced everybody. I always feel like, I kind of feel like when I get to the program design stuff, I always kind of start like a lobbyist where I'm just like, here's why resistance training is so good. Here's why this is important. This is one of the reasons why we always do our tug test, by the way, with our senior clients. That timed up and go assessment. It's an excellent assessment for your senior clients. The idea here is that you are identifying any fall risk that your client may have. Again, it's the same assessment that we talked about, where they're going to sit in a chair. There will be a cone 10 feet or around 3 meters away. They're going to get out of that chair, walk around the cone, and then sit back down. And then you are going to assess how quickly they are able to do that. The faster they're able to do it, the, you know, more agile and the better balance you are sort of observing, right? Looking at a little bit more of like the benefits of fall prevention, we know that there are like more than 100 different risk factors, both intrinsic and extrinsic. What we mean by that is, like, you know, I kind of boiled down falling and landing and reacting. I kind of boiled that down to, like, you know, the foot and ankle, the calves, the knee complex, the hamstrings. I kind of boiled it down to a couple little tiny ones. But obviously there's a lot of factors that go into play as we get older, you know. Again, go back to our nervous system changing. As we get older, we know that our dendrites sort of thin, and everything travels down a little bit more slowly throughout the nervous system. So if reactive training literally is all about, like, your nervous system reacting to something, it makes sense that as we get older, you know, that reaction time slows down. And so that gets very challenging. But again, light at the end of the tunnel. I feel like this is another thing that we always do in these PowerPoints. I'm like, here's why it's important. Here's what's going to happen. And then I always go, well, here's the thing though, physical activity improves all of it, you know. Like, working out regularly has such a great positive effect on reducing your risk for falling, because you are literally training in a safe environment to do those falls, you know. So we love the tug test because that's going to help us identify if your client is at risk. And then we love to use the OPT model. The OPT model is going to be very, very helpful here again, because it will reduce our risk, and it builds progressively, you know. Like, it can be used to address your core training, your balance training, your reactive training, but it does it through a progression. It starts, you know, nice and safe in the stabilization level, and then it works its way through into the strength level before finally ending in power. And again, you know, if I've got a senior client who qualifies for it, I'll totally do power. They just have to, you know, it's just the same thing with any other client. Like, it's based on postural control and proper mobility. If they can't move their joints through a full range of motion, you know, it's totally inappropriate for me to put my client into the power level, you know. And we've talked about this before. I know that, like, for those of you who have been through program design, this is going to say, you know, all this stuff sounds so very familiar. But again, it is meant to be like a staircase. Like, you're working your way up from your foundation, you know, to the peak, right? And so we start by, you know, focusing on learning how to stabilize everything and hold stuff in place. Then we learn how to move stuff through a full range of motion. Then we learn how to move stuff through a full range of motion at explosive speeds. Oh, this is funny. Check this out, Robert. Remember, I don't know if I'm pretty sure I've said it in class before, but you remember how, like, I've said that the OPT model used to be 7 phases? Here's the original when NASM first started. Here's the original OPT model. Check this
They
out.
got maximal power and what is that? Stable endurance.
Yeah, well, stabilization, actually, that's the thing. Actually, stabilization endurance is the name of the phase. Stabilization is the name of the level. So that actually hasn't changed. It's just that I have this bad habit. I always shorten it and I just call them both stabilization. That's a really bad habit, technically. The phase is stabilization endurance. The level is stabilization. But see this here. This is corrective exercise is phase 1. Corrective exercise was essentially all this foundational work that you would do before you would even get into like traditional working out. And I always like to think it was like phase 0.5, really, and then you have power, and then you have maximal power. Maximal power was like all of these sports specific stuff. So if you have like an athlete who is training for like a specific event, like baseball, for instance, like that, massive twisting that they have to do, you would be training like maximal power there. But what they found is, and I think that they fixed it in the second edition. I never studied under NASM in this version of the OPT model. When I came in, it was like a big conversation. They were like, it used to be 7. And it was just like a thing that everybody, and I was like, I don't care. Just teach me the thing. Kind of like I'm doing to you now. But, but phase 1, they ended up removing this, and it became the very first like NASM sub certification, the first CEU packet, which was corrective exercise, the NASM CES, which is the one that you're getting in capstone. And then phase 7 became the NASM PES, and that was their other second certification, and that was I guess their third certification, we'll call it. And that's the one that we're going to study next module for program design. We'll do the PES book. But this became the CES, and that became the PES, and then this is the regular OPT. There's your history lesson for the day. Okay, so let's talk a little bit about core training before we kind of dive in here. So, and by the way, really quickly, same asterisks that I've been putting on every time we do program design. Obviously, this program design class is being taught out of like the senior packet, but at the same time, we are following the chapters that are in your textbook, right? So like my priority is to prepare you for your regular NASM exam. All of these numbers are going to be exactly the same. However, you're going to see like little notes and stuff where it's like, well, seniors, you probably won't end up doing, reactive power. Doesn't mean I'm not going to teach it to you today, though. Like, we want to do all of the individual sections for each of our individual levels here, even if they are not common among seniors, because again, we're kind of practicing for the regular exam. So looking at your core training, right? Many of your, again, this is such a common sentence. You see this sentence all the time, and it is always true. But many people lack stabilization muscles to properly control the lumbopelvic hip complex. So, what we tend to see when we look at like your core, right? When we look at your core, we have 3 different systems. Let's see here, local stabilization. Let's see here. That should pull up the table. No. Come on. There we go. Okay, so here's a little table that's found in the core chapter in your textbook. Ooh, that is low quality. Really? Come on. Give me one that's just a little bit higher res. Sorry. Muscles of the core, table 9.1. Come on. Pinterest. Well, that sucks. Okay. This is probably going to be a little bit hard to read on your end, but I'm going to walk you kind of through it. So the muscles that we've got in your core, right? A lot of people think of their core, they're like, oh, it's your abs, right? But we talked about this in kinesiology. It's not just your abs. There are several core systems, right? So you have what is called your local stabilization system. When you think of like local, right, you want to think close to home, right? You're a local. That is going to be all of the stuff that stabilizes your spine, because that's about as close to home as it gets, right? Your spinal column, that's got all the information running throughout your body. That is your center, right? So that is going to be muscles like your TVA, that's your transverse abdominis. That's creating stabilization in the front, right? So it's this kind of webbing that creates intra-abdominal pressure in your abs on the front there. Then we've also got your internal obliques on both sides, right? So running up the sides of your spine, they're creating internal pressure, again, to kind of isometrically stabilize and hold everything in place on the sides. Then you get your multifidus, which are these little itty bitty, like we call it the multifidus, but really it's your multifidi. It's all these little individual tiny, tiny, tiny muscles that are holding each and every one of your spinal discs in place. And so, a lot of times we think of like the two large muscles along our low back. We think of like the erector spinae. That's in charge of like, erecting my spine, causing spinal extension, right? But all of the stability part of it that runs between each of my spinal discs, those are your multifidi. Then you've got pelvic floor muscles down here creating pressure upwards, and you got a diaphragm up top creating pressure down below. So when you think about that local stabilization system, right, its job is to hold your entire spinal column in place so that those discs don't slide around and get dislocated or bulged or herniated or anything like that. So what we're seeing is kind of a perfect box here, right? We see like the sides of a box, we see the front of a box, we see the back of a box, the top and the bottom, and all of that creates pressure to hold everything in place, because that's what boxes do, right? Hold stuff in place. Then you do have your global stabilization system, right? So this is creating spinal stability around the outside of all of that, right? And so this is where you get separate layers. So I've got my quadratus lumborum running from like my bottom rib to my pelvis here, right? And that's job is to kind of move me side to side like this, or to like raise my hip up like that, right? Then I've also got my psoas, right? That's running from like, that's attached to my spine, and it runs down and attaches to like my femur actually, right? So that's creating, movement of my spine downwards here. That's why I actually remember the hip flexors, right? Your psoas are sometimes on that list that causes you to excessively forward lean if it's not being caused from the calves. We see your external obliques, your rectus abdominis, and your erector spinae. So now we're seeing like all of the muscles that are laying on top of our original core muscles, right? We had like my transverse abdominis creating stability, and then on top of that, I've got my six pack, and that's in charge of, creating spinal flexion. I've got my erector spinae running over top of my multifidus, and that's causing spinal extension. And I've got my external obliques laying on top of my internal obliques, causing rotation, right? And then we've also got the adductor complex there as well, creating some stability on the sides. Then, so that's your global stabilization system. And all of that is there to create stability within your body, right? And make sure that your spine moves the way it's designed to move. We also have your movement system, right? And this is going to be the stuff that kind of moves you around the globe. And it consists of the stuff that moves your legs and your arms, right? So we're definitely going to see the latissimus dorsi there, right? My lats are in charge of spinal extension, right? Then I've got my hip flexors, right? My hamstring complex and my quadriceps. So all those muscles that are allowing me to really kind of move my pelvis around. So we've got the local stabilization holding your spine in place, the global stabilization moving your spine, and your movement system moving your lumbopelvic hip complex / shoulder complex, really. So that's what we're seeing in those different sections there. Now, this statistic right here, which you will see many, many times listed in a lot of different NASA materials, which is always true, is that many people lack stabilizing muscles to stabilize their lumbopelvic hip complex. And what they're saying there is that a lot of people have a really strong movement system you know, because like that's sort of how we, you know, we're constantly moving around, we're lifting boxes into and out of the car, you know, we're using our muscles here and there. So we develop our movement system, but a lot of people struggle with maintaining their stabilization system. So you end up getting this ability to like wrench your spine around really well, but then you don't have the ability to hold each of the individual discs in place the way they're supposed to sit. And so that's where that becomes kind of dangerous, right? And so that's why it's really important for us. You know, we see imbalances if the movement system is strong and the stabilization system is weak. We see a lot of predictable patterns of injury. You know, again, you think about like each of those individual little spinal discs, right? When you look at those, if we get really good at like wrenching these around, but we don't get very good at like stabilizing them, what we'll often end up with is a herniated disc, right? So there's all of this like soft material running between here, and then that soft material gets torn because it gets pinched between two very, very hard bones, right? Or wrenched out of a range of motion that it was really designed to. And so that's where you see this lining here get torn, and then all this material in here starts to leak out. And then all of a sudden, it starts touching these nerves on the side here, right? Those little spinal nerves. And when that happens, you start to get just random aches and pains that kind of come out of nowhere. So that's one of the biggest reasons why it's very important for us to start the OPT model in stable. Oh my God. Click the right things, please. That's why it's so important for us to start in stabilization. We need to build our foundation first so we can build up the harder stuff later. Let's learn how to hold the spine in place before we start moving it. So we are going to see 3 levels of core training. Shocker, I know. It's going to be stabilization, strength, and power. Now, for those of you who it's your first time seeing program design, we are going to call all of these exercises basically what concept of athleticism we are training, which in this case it is core training, followed by the level, right? So we have core stabilization exercises. This is the difference between being somebody who is like an amateur versus being an expert. Like if I go like this, right? Core exercises. Boom. Here's a friggin', there you go. There's a ton. 9 low impact exercises for a rock solid core. I don't disagree with a lot of these. I think a lot of these are great, except for the side crunch, which is always stupid. But these are pretty good, right? And look at this, they even got a cobra in there working on like the back, which a lot of people will be like, well, that's not my core, right? My core are my abs. This is not terrible, but here's the thing. We look at a couple differences between these movements. We got the planks here, right? We've got the oblique twist, reverse crunches here, ab roller, bird dog, hip raises, cobra, flutter kicks. You know, these are different from each other, right? Like this involves movement of the spine, although there is a lot of stability there because it is a roller, right? Hip raises is all about like up and down motion, right? That's kind of moving, unless they're just like holding it in place, which it doesn't really say here. Planks, that's a stabilization movement. Crunches are definitely like a moving movement. Flutter kicks may not be a lot of movement in the spine, but it is a lot of movement in the lumbopelvic hip complex. Reverse crunches, that's a lot of motion, right? So here's the thing, like, how do we know which one's the most appropriate for our client? Like, first off, I do really like all of these exercises except for the side crunch. I'm a fan of all of these. But I want to make sure that I'm progressing my client appropriately. If they've already got a really strong movement system and they have a really weak stabilization system, I'm not helping them by getting them even better at moving their core, right? I got to make sure that I am focusing on stability first and movement later. So our exercises, if we are in the stabilization level, again, we are training for the core. So we're going to hyphenate it and we're going to call these core stabilization exercises. That is our exercise selection for level 1 clients. Just like we looked at, like our category was corrective flexibility. That consisted of self-myofascial release and static stretches. If our client's in stabilization, we're probably in stage 1. Stage 1 consists of Yeah, zone 1, right? Well, the same thing is true here. If my client is in level 1, which is stabilization, and I am training their core, I am going to do core stabilization exercises. So how do I know if something is a core stabilization exercise or if something is a core strength exercise, right? Because here's another routine. This is also not bad, right? Actually, you know what? I'm gonna open this up real quick and keep that separate. And we're gonna come back to it in just a minute. Here's another one. Whoops, nope. Here's another one, right? There's a million programs out here with a million different core exercises, right? So how do I choose the ones that are most appropriate for my client? Well, this is the thing. Our goal in stabilization is to create spinal stability. So the core exercises that we are going to choose are core exercises that involve little to no movement of the spine and pelvis, right? So that's what core stabilization exercises are. They are exercises that involve little to no movement of the spine. So going back to our first example here, right? The oblique twist is totally inappropriate if my client does not have proper core stabilization. I'm asking them to twist and move their spine through this big range of motion. If my client's a beginner, that could be way too much, way too fast, and it could result in an injury, right? So instead, I'm going to focus on these movements that involve little to no movement of the spine. A lot of these are going to be either performed at a slow or isometric tempo. Now, again, we know that like clients who are seniors, oftentimes we avoid isometrics because there is often blood pressure issues. So you probably end up doing these at a slow tempo, which is why like most of the time it's actually listed as slow, even though a lot of these exercises do tend to be isometrics. So good examples are things like the side iso abs. That's a big NASM fancy way of saying side plank. Opposite arm, opposite quadruped leg raise. That's a big NASM fancy way of saying bird dog. And so actually I saw this picture. This is a really kind of good example, minus the crunch here, right? The crunch is, you're moving. But see, like, there's like a front bridge. There's the bird dog. This is literally just an isometric tabletop hold with like the head up. And then there's the regular tabletop hold over here. Prone cobra, right? Bridge, if this was isometric, if you're just holding in place. All of these are really focused on creating stabilization. They're all focused on like kind of staying in one spot, which is really what we are going for when we are focusing on spinal stability. By the way, if you want one of my all-time favorite, I know I talk about this a lot, but if you guys want my favorite core routine for any beginner client, check out the McGill Big 3 exercises. Stuart McGill is a physical therapist who has been, kind of specializing in the core for years now. And so he firmly believes that really the big 3 best stabilization exercises that you can do. I can't believe I can't find there we go. I just want a picture with all 3 of them. The best 3 you can do are this movement right here. So this is called the McGill sit-up, which is not actually a sit-up. It's where you just crunch and you hold your spine. It's kind of like a plank, but face upwards. Then you got side planks, and then you got bird dogs. And this is going to kind of hit, the front, sides, and back in terms of stabilization for your spine. One of my all-time favorite routines right here. I think this is absolutely fantastic. And you'll notice it's not about movement. It's about controlling movement or stabilizing, right? Holding in one place. So we love planks, we love bird dogs, we love side planks. All of those are core stabilization exercises, and they're totally appropriate for my clients in level 1. Now, in your textbook, obviously you've got the list of all of these. They're not only in chapter, what is it, 9? Yeah, chapter 9. On page 235, you will see it is listed as core stabilization exercises, and it's going to have your list. So marching, it's actually really similar to the McGill setup. 2-legged floor bridge is going to bridge and kind of hold, right? Then we got the floor prone cobra, which is like really kind of a low back exercise, but again, it's all about stabilization. And then the prone iso abs, that's your classic plank. So those are all in there under core stabilization. Then we're going to move to core strength, but we'll get to there in a minute. Those are not the only places you can find those pictures. Obviously, there are also more examples in the back of your textbook as well. In the appendix, it will start with core stabilization. So you've got a ball bridge here and the quadruped opposite leg, opposite arm raise on page 577. So just make sure, guys, whenever you're trying to navigate your textbook, you're paying really close attention to what it says like at the top, right? Like this is the core. These two here are core stabilization exercises. Then it's going to move to core strength, and then it'll move to core power. So always pay attention to like, make sure you're at the right section header. So core stabilization exercises that involve little to no movement of the spine. You can choose any of those. And when you're choosing your numbers, you're going to do about 1 to 4 sets of those. You'll notice this is actually the highest number of sets that we do anywhere in movement prep when it comes to program design. The reason for that is because like it's just always a good idea to put an emphasis on the core, you know? Always a good idea to maybe get a little extra core work. You can do 12 to 20 repetitions if you are doing repetitions. If you're doing isometrics, you're just going to do an isometric hold. You're going to do a slow 4-2-1 tempo. So if you are doing reps, right, that's going to be 4 seconds eccentric, 2 seconds isometric, and 1 second on the hold. And then you're going to do 0 to 90 seconds of rest. 90 seconds is actually a fairly long time here. But again, these are often very beginner clients, so you want to make sure they're fully recovered before going into your next set. Then we have got core strength. So if my client, if I build up a good foundation of stabilization, then I can move my client, you know, I'm like, all right, I firmly believe that, you know, due to our training, you now have a great stable core. It's being held in place exactly the way we want it. Let's go ahead and start developing the ability to move that spine. Now that we taught the body how to hold the spine in place, let's talk about moving the spine through a full range of motion. And this is where we get into level 2, right? We're going to get into the strength level here, right? This is going to be, now here's the thing, when it comes to exercise selection, it's level specific. So our exercise selection is going to be core, because that's what we're training, strength exercises. Now, obviously there's phases here, right? We see the strength endurance phase, we see the hypertrophy phase, the max strength phase, but there's no such thing as strength endurance exercises, hypertrophy exercises, max strength exercises, right? They're like, strength is the level. That is what determines your exercise selection. So you're going to choose core strength exercises, whether your client is in phase 2, phase 3, or phase 4. Any of those phases falls under the strength level. Therefore, you're going to choose core strength exercises. Now, these are exercises that involve a full dynamic, so under movement, concentric and eccentric range of motion of the spine. So we taught our spine how to be held in place. Now we're teaching our spine how to move, right? And so what we're going to do is, you're going to notice the intensity is going to go up here, and we're going to get into a lot of sort of what we think of when we think of like core exercises. You know, like when you think of a bunch of traditional core exercises, you're thinking of things like crunches, sit-ups. No, that's like, I mean, it is kind of core, but it's like they keep throwing leg stuff in here, which I really like. I think that's actually not a bad idea. There we go. Ab exercises. There it is. So, you know, we're looking at like, look at all these freaking things. Crunches, high crunches, scissors, sit-ups, L-sits, toe taps. Dead bug is kind of a stabilization one. Knee to elbow, climber taps, you know, all of these motions, we're just moving our spine around. I love them. They're great, by the way. I'm a big fan of core strength exercises if you have proper stabilization. So our intensity is going to go up a little bit, which is why we're going to see our repetitions go down. That's one of the things that we know about the strength level, right? Like, you'll notice intensity continues to climb throughout the entire OPT model, right? It starts with low intensity and then works its way up. So we're going to do less sets instead of 1 to 4. We're going to do 2 to 3 sets. I guess technically 1 could be considered less. I guess that averages out to, what is that? Oh yeah, no, never mind. Yeah, we're going to see more sets here. I was trying to average out. Like that's 6. This is, oh yeah, no, never mind. It is backwards. Sorry. But we will notice the sets go up because our reps are going to go down, right? And we know that sets and reps are in an inverse relationship. They are opposites to each other. So 2 to 3 sets here, 8 to 12 repetitions. That means the intensity is going to be much, much higher. And we're going to move at a medium 202 tempo, right? So that's going to be moving us through a full range of motion. I will say this, I'm not a big fan of a 202 tempo on the core. I like to have a little pause at the top. I really like a 212 or a 222 or a 111 tempo personally. You know, when I'm doing like particularly ab exercise, I like to have a little stabilizing up at the top there. That way I am working on like, you know, building up that 6-pack, but I'm still getting a little stabilization in there. And then we're going to take 0 to 60 seconds of rest. So our rest is actually going to go down here, which is a little surprising because whenever intensity goes up, usually rest goes up as well. But the only reason it's going down is because like 90 seconds is fairly excessive. That was just in there for beginner clients. So we see the rest go down a little bit only because it was exaggerated the first time, not because it's in comparison to the first time. So really good examples are things like cable rotations, right? That's that classic kind of wood chop where you're moving through like a full range of motion, right? Like that's movement of the spine. And then we have stability ball crunches, right? And then stability ball back extensions, right? All of those are really good core strength exercises. I love the fact that the stability ball crunch is mentioned here in particular. This is one that always surprises people. God. This is one that always surprises people. Stability ball crunches are a core strength exercise. And a lot of people are like, whoa, 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 whoa. It's on a stability ball. It's wobbly. Doesn't that mean it's a stabilization exercise? In any other part of the OPT model, you would be totally right. If it was a shoulder exercise and you were sitting on a ball, that'd be a shoulder stabilization exercise. If you were doing a chest exercise on a ball, chest stabilization exercise. Ball squats, right? Leg stabilization. But that is not how we define our core exercises. Our core exercises are defined by what is happening to the spine. Is it moving? Is it not moving? Is it moving, or is it moving fast? That is what determines whether or not it's a core exercise. And the stability ball crunch is full range of motion of the spine because you are crunching. Therefore, it is a core strength exercise. So the reason I want you guys to know these defining characteristics, these exercises, like defining characteristics, what the exercise involve. The reason I want you to know this so freaking clearly is because there are going to be a million exercises on the internet that are awesome. They're so freaking good, or they're just things that aren't in your textbook, and you're going to need to know where to put them on your OPT templates, right? Or where they fall in the OPT model. And the more you know those defining characteristics, the more likely you are to be able to pick where to put those movements in an actual like workout scenario, you know? So that's why like I'm such a big fan of like making sure that we know these defining characteristics. Also makes it a lot easier than having to memorize every exercise in your textbook and where they belong. That's harder than it is to just understand their defining characteristics. So if you're looking at the core, ask yourself, does the spine move through a full range of motion or not? Does it not move? Does it move? Or does it move fast? Stabilization, strength, power. Now, really quickly, it's going to want to move. Oh, it does have core power. Oh, shoot. I must have moved it without realizing. So lastly, our third level here, which would correspond with our 5th phase, right? So this is our 3rd level. That's where we're going to get our exercise selection. Our 5th phase is the name of the type of the program. Exercise selection is going to be core power exercises. So now we've got our core stabilization, core strength, now we're at core power. These are exercises that involve a full concentric and eccentric range of motion of the spine. So really what's kind of funny here is like, this sentence is literally the same as this sentence right here. It's core exercises involve a full concentric and eccentric range of motion of the spine, right? But then you're going to see there's this little bit tacked on at the end that makes it power. And it says at functionally applicable speeds, which is a NASM way of saying fast. So we didn't move the spine. We moved the spine. Now we are moving the spine fast, right? And that is what we mean when we say a core power exercise. So a medicine ball slam is a great example of that, right? If I've got a medicine ball, wham, and I slam it onto the ground, right? That's a really super explosive movement of my spine. So I'm going to do 2 to 3 sets here, 8 to 12 reps. That's actually about the same as what we saw up here. But now my tempo is explosive. My tempo is XXX. Every repetition should be as, or every muscle action, whether it's eccentric or concentric, should be as fast as possible. And then I'm gonna take 0 to 60 seconds rest. So a medicine ball pullover throw. Which is this exercise right here. Mute. Where he is crunching up and he is going to throw that ball to a trainer. Or I guess maybe just across the room. Is there a trainer? Yeah, there's a trainer. Now here's the thing. Here's what I'll say. I actually do not like how he is doing this. His form is good, like in terms of like his motion and stuff. It's great. Like he's crunching his spine, he's on the ball, like he's doing it totally the way he's supposed to, right? Full extension, and he's got his, he's crunching his spine there. I actually really like it. Here's what I don't like. He is going super slow on his loading phase. That eccentric portion is very, very slow. Now, obviously, I don't want him to wrench that ball backwards and like his feet come up and then like do a backflip. Like we don't want that either. But that slow range of motion there is preventing him from working his core in all 3 muscle actions explosively. So what we would rather see, I think this is the one. No, that's definitely not it. This one, where's the one where he bounces off the wall? This is a little bit better, but you see how he's being explosive in both directions. He's not super explosive on the way back either, but it's definitely like much more explosive in both directions. But what you do see, whether or not it's explosive on the way back, what he's not doing is he's not pausing. He's not taking a big long pause in between every rep. And that pause, right? We don't want to do this at like an X. We don't want to do this at like a 1, 2x tempo, right? That's a really weird tempo. We want to be explosive in all directions. I'm trying to teach my muscles to react, right? To be explosive in eccentric, concentric, and isometric. So one of my favorite ones here, and I think I got it listed, is the medicine ball rotation chest pass, which is definitely going to involve your chest as well here. But when you're doing this, reactive training. When you're doing this, right, I'm gonna have a trainer lined up over here, okay? And I'm gonna have a medicine ball in my hand. And when I do this, I'm gonna keep my front leg straight and I'm twisting like this and throwing that ball. But here's the thing, when he throws that ball back at me, I don't wanna go like this. Wham, and be explosive, right? Because all that does is that's explosive in one direction. So what I wanna do is I wanna stay facing my trainer. He's gonna send me the ball and I'm gonna go bam, bam. Explosive in both directions, all directions, and as little pause as possible. I'm definitely putting some emphasis on this right now because that is how these exercises are intended to be performed and how these exercises are most effectively trained. But guys, next mod, we are moving into the sports mod. This explosive tempo thing is the only thing I'm going to be harping on all class. Like eccentric explosively. So many people jump like this. And they do these big long holds. And it's like you are losing explosiveness. You want to go down and up. You want to be explosive in both directions. And you do not want to have an isometric pause in the middle. That is killing your reactivity. So medicine ball pullover throw can be explosive in both directions. Medicine ball chest pass can be explosive in both directions. Medicine ball wood chop throw. Honestly, that one is really hard to do explosive in both directions because like it's literally doing this. You throw it behind you. I don't know who's going to get you to, throw you a ball. But if it's a core exercise that you don't have like a good reload, there's no reason you can't take that ball and go like this and then throw it, because then you can create that explosive. You may not be catching it, but it's still explosive in both directions. So, core safety guidelines, especially with your senior clients, although this could be true for anybody. Watch for dizziness if your client gets up too quickly. Remember, we talked about if your client has hypertension, changing the orientation of their head, that can be kind of dangerous. So be cautious with that. Watch for muscle cramps. That can definitely be a thing with your clients, If you start to see that like they tend to cramp up in their core, it can be really uncomfortable and painful. So be aware of that, especially if, senior clients tend to cramp up a little bit easier than a lot of others. Encourage deliberate breathing. We do not want our clients to hold their breath. That can cause their blood pressure to spike. And avoid excessive flexion extension. So, massive hyperextensions and things like that. Like I really like hyperextensions as an exercise. This is a great core strength exercise. It's strength because it's involving movement of the spine, right? My erector spinae is getting a great workout here. I like this movement. But I would definitely avoid excessive range of motion with like my senior clients, because again, it's going to put a lot of pressure on those discs, and a lot of your clients, 80% of people deal with low back pain chronically at some point in their lives. It's very, very common in our seniors. By the way, I also really, really love this exercise. Reverse hyperextensions are arguably one of the best exercises in the entire gym, even if they are kind of silly looking. Reverse hyperextensions, I know it's kind of a goofy looking exercise, but man, guys, I cannot tell you how freaking good this exercise is. It is so, so good for your glutes and your erector spinae. I love this movement. Everyone should do this movement. All right, I'm done. So that's the core. Robert, you got any questions?
I guess when it comes to like blood pressure and keeping your clients off the floor, but then at the same time, a lot of the stabilization exercises are isometric. So I don't know. I guess I kind of have like.
Yeah, it seems like a catch-22, right?
Yeah, it kind of confuses me a little bit.
So it's not that you can't get your clients on the floor ever. It's just that you want to avoid rapid. I mean, it does say like a lot of times avoid the floor. What they really are looking for on that. This is why I tend to. You don't hear me say keep them off the floor as often as I say don't change the orientation of their head too quickly. Like notice how like sometimes I say that instead of like the floor thing.
Yeah.
That's the thing. Like if you are on the floor, like let's say you're doing a bunch of static stretches, right? And you're gonna do like a 90-90 hamstrings where you lay on the floor, take your leg up, you do a piriformis stretch right on the floor doing that figure four. Let's say you do like a lot of that. If you do all of those on the floor in like a sequence that keeps their head in the same orientation, like I love to flow from like, I'll use like a yoga strap to do like a supine calf stretch where I lay on the back and do like the calf, then go into like a 90-90 hamstring, into the figure four, into like a spinal twist. That's like 4 exercises in a row where the orientation of their head's not changing rapidly. Then I can tell my client, all right, I want you to roll to the side, push yourself up gently, take a second. That's going to give them time to kind of stabilize. Then I can maybe do like a sequence where I'm nice and upright, I would say that's more important. Now, that being said, let's say you have a client who really can't get on the floor. Maybe it's just difficult on their knees, but you really want to do some type of planking exercise, there's no reason you can't do like a modified version of a plank on like their bed or something like that, right? We do that with our obese clients pretty frequently, actually, because a lot of times it is very difficult to actually get on the floor, not so much because of blood pressure issues, but just because like impact issues. So there's always something like that. One of my other ones that's not in your textbook that I really love is like it's like the side plank of stabilization exercises, is literally just a cable rotation hold. So you grab like a cable machine, you know, thread the arm and then like just hold it right here. So it's trying to rotate me this way and I'm resisting it by just holding like this. And I'll even sometimes make my clients do like a lateral walk. Yeah, they're doing a little bit of movement, but their spine for the most part staying stable. Or there's a really great exercise called a Palov press, which is the same thing with like a cable going this way, but then you press forward like that. And so like as you move through this range of motion, it wants to twist you and you're resisting it. So there are options, but you're right. There's not a ton of, I'll be honest, there's not a ton of options kind of in the classic NASM realm, you know? But does that kind of help fill things in a little bit for you?
Yeah, I guess you could compensate with some of them standing, but like you said, there's not a lot that you can choose from. So
yeah, and that's that's okay. That's the one thing that sometimes I don't know if it's a sad truth. I don't know if I that was the first thing that popped in my head. I was gonna say it's a sad truth of writing good routines. I don't know if it's actually that sad, but one of the real truths is like sometimes effective workouts are not flashy workouts. you know, I love all that cool stuff we see on Instagram. you know, like some of the stuff people come up with, I freaking love that stuff. But a lot of times the simplest stuff is the most effective. So your library doesn't have to be good, or it doesn't have to be large to be good, All right, let's look at balance training here. So balance training, definition of balance, right? How far outside of your base of support you can maintain your equilibrium. So when I say balance, right, if I was standing on one leg, and I were to reach my leg out like this, and you were to measure how many inches that is, right, or here, right, that's balance. It's how far outside of your base of support, which in this case is my left foot, right, I can move without like, falling. It is a dynamic process. A lot of people think balance is a very static process. It's totally not. There's so many little tiny movements that are happening there. So it's a dynamic process that involves a lot of micro movements. And what's awesome about balance training is that it develops that neuromuscular efficiency, right? Neuromuscular efficiency, one of the things that we are always striving to create as much of as possible in the body. That's the ability to recruit the right muscle at the right time for the right amount of force in the right plane of motion, right? So we want to teach our muscles how to fire the correct muscles at the right time, and we want to teach them how to fire the way they're supposed to, right? Great things about balance training: it enhances your proprioception, it reduces your risk from falls, and then we do know that we have sort of a progression here. We've talked about this before, but there's a ton of benefits to balance training. And we want to make sure that we are progressing our clients so they get better and better and better at it. The more balance they have, the less likely they are to deal with any of the injuries that we've kind of been harping on in this senior class, right? It's going to prevent lower extremity injuries. It's going to improve your lower extremity biomechanics. And it's going to have really, really positive effects in fall prevention. So we do have 3 levels here. But we also can progress and regress all of these exercises using equipment as well. So you're going to go from the floor onto a balance beam, onto a half foam roller, onto an AirX pad, onto a Dynadisc. That is our appropriate progression when we're doing things. So like, let's say I'm doing like a single leg lift and chop, right? So I'm standing on one leg, I've got a medicine ball here, right? I'm standing on one leg and I lift it to my opposite side and then take it back down, right? If that is too easy for me, I want to do that type of balance exercise, but I need to make it harder. You can put me on a half foam roller, right? Half foam roller likes to twist side to side like that, right? It moves through one plane of motion, moves to the frontal plane. So now suddenly I've got a little bit of instability there. Then if I want to make it even harder, I can put myself on an AirX pad. That's going to move through two planes of motion, right? So I'll get that like kind of squishy pad under the ball of my foot. Then if I get really good at that, I can move on to a dyna disc, right? And a dyna disc is like full range of motion. Not only can it move front to back and side to side, it can also rotate and circle around. So that progression is going to make things really, really challenging for me, and ensure that like I'm improving my balance, and I'm getting all kinds of new stimulation so that like it continues to be difficult rather than just, you know, raising the weight or something like that. So guess what? 3 types of exercises based on the 3 levels. If your client's in the stabilization level, we are training for balance. So you are going to do balance stabilization exercises. How do you define a balance stabilization exercise? This sentence is going to sound super familiar, but they are balance exercises that involve little to no movement of the balance leg. Let's go back to that core stabilization for just a second. Core exercises involve little to no movement of the spine and pelvis, little to no movement of the balance leg. And guess what? We are in the level that is literally called stabilization. You starting to see like a pattern here? Stabilization is all about not moving. It's all about learning how to keep everything in our body. Keep it held in place. Don't let that stuff go wandering, you know? As we're looking at this, right? We are looking at 1 to 3 sets of 12 to 20 repetitions if it's a double-sided exercise. Although, honestly, I can't even really think of an example. Almost all of your your balance stabilization exercises are single-sided, so that will be 6 to 10 repetitions each. Your tempo should be slow. That's 4, 2, 1. And you're going to do 0 to 90 seconds of rest. Really good examples include the single leg balance, which is literally this. That's the whole exercise, right? We've also got the single leg balance with reach. That is actually going to be where you're going to do 3 different versions of the single leg balance with reach. You're going to do a sagittal, frontal, and transverse version. So this is sometimes called multi-planar single leg balance with reach. But you're going to go sagittal, frontal, and then transverse. And on transverse, you really do kind of want to scoop, because that's going to give you that transverse external rotation of the hip to really turn that glute on. So don't just like take your leg back, right? Because all that is, you know, hip extension. So you're going to scoop it, right? So that's single leg balance with reach. And then there is also the single leg lift and chop, which I showed you a second ago. Now, again, you're noticing, so you should be noticing something here, right? Single leg lift and chop is this one, right? I am moving, right? Like during all of this, I'm creating like single leg balance, right? I'm lifting my leg up, I'm bringing it down, right? Single leg balance with reach, I'm moving my balance leg, right? Single leg lift and chop, right? I'm lifting, I'm chopping. I'm definitely moving, but what I am not moving is my balance leg. So if I'm standing on one leg like this, yeah, I'm doing all kinds of stuff, right? But this is not moving. That's what makes it balance stabilization. If the balance leg doesn't move, it's a balance stabilization exercise. Even if, let's say I'm standing on one leg and I've got a trainer in front of me and I did like a medicine ball chest pass, which is reactive and explosive. But you know what? If I'm using it for balance training, this leg didn't move, it is a balance stabilization exercise. Even if I'm being plyometric in my upper body, even if I'm being power up here, what I'm training is this. Does that make sense?
Yep. Gotcha.
That's going to be an important concept in just a minute when we look at the strength stuff. So let's look at the strength stuff. So we've got the strength level is level 2 here. We are going to choose if you are in phase 2 or phase 3 or phase 4, we're going to choose balance strength exercises. And these are balance exercises that involve a full concentric and eccentric range of motion of the balanced leg. Again, that sentence should sound really familiar, right? No movement of the spine, no movement of the balanced leg, right? That was stabilization. Full movement of the spine. Guess what? Full movement of the balanced leg. So now these are balance exercises that involve movement of my balanced leg. So rather than like, you know, moving my other leg around, but this balanced leg on my left here is not moving, right? Well, now if I go like this and I squat down, actually that's more of a hinge. If I deadlift down, right, and touch the floor, I'm bending my knee joint, I'm bending my hip joint, I'm bending my ankle joint, right? All three of the things that are, my balance leg is now moving through a range of motion. Let's say I did like a curtsy lunge, right? Where I step back like this, right? That is movement of my balance leg, or even just like a single leg RDL. I don't have enough room to do a single leg RDL. I want to show you from the side, but you know, if I hinge with a straight leg, right? That's movement of the balanced leg. So that is core strength. So single leg Romanian deadlift, single leg squat touchdown, or even just like a lunge to balance, right? Like if I go, you know, into a reverse lunge, step up to one leg, right? My balance leg stepped up into balance, which actually leads me to the step up to balance exercise, which is one of my favorites. Step, whoa, balance, right? So step, balance. My balance leg is this leg up here. It's moving through a full range of motion. So 2 to 3 sets, 8 to 12 reps each, medium tempo, and 0 to 60 seconds of rest. Now, the reason I want to use the step up to balance as an example here. Here's another thing about choosing exercises, guys. There are certain exercises out there that can be used in different spots. The step up to balance is a really good example of this. So step up to balance, if I'm writing a workout, right? Here's a blank OPT template. If I'm writing a workout and I choose to do the step up to balance, if my client's in phase 2 or 3 or 4, my step up to balance belongs here in the movement prep. Okay, this is now a balance strength exercise, right? But here's the thing. Sometimes you will see this exercise show up on our list of leg stabilization exercises, which means it belongs in the sort of meat of our workout, the resistance section. This is sort of the main, you know, when you think of leg day, right? If I was doing leg day and I was in the stabilization level, I can do the step up to balance. It just needs to be performed in phase 1. And the reason for this is because, like, if you think about like core balance and reactive, right? This is really, I mean, it's not your warm up, but it is like your pre-workout. It's your muscle activators, right? So this is almost like a warm up exercise in the upper middle level of the OPT model, but it is part of the meat of your workout if you're in the stabilization level. So that exercise can be used in 2 different places. I could totally go back just a minute ago and use that medicine ball chest pass on one leg. If I were standing on one leg like this and I were throwing it, what am I working on? I'm working on my balance. Great, put it in stabilization. If I'm being super explosive about how I throw it, but I just need to make it harder because I don't have a heavier medicine ball, well, then I can call it a chest power exercise, right? Exercises can be used in different places, even if they are the same exercise. It just depends on what you are training at the time. So like if I've got a client and I'm doing a medicine ball chest pass and they aren't explosive about bringing it in and getting it back quickly, well, if I'm working on their balance, I don't really care about that. What's important to me is that they're balancing properly. And if I've got a client who I'm trying to build explosivity in their chest and they're having a hard time, like they hold on to it and then they throw it, but their balance is good, well, I care less about the balance. I care about the explosiveness. So I'd be like, hey, we're going to regress this and put you back on 2 feet so you can be explosive. I'm like, no, it's easy. And it's like, no, you're not, it doesn't look easy, you know? So that's what's important there. You need to make sure that you're, you know, all of these things are concepts, you know, we're training specific things at specific times. All right, lastly, we're going to look at balance power. These are balance exercises that involve a full dynamic range of motion of the balanced leg at functionally applicable speeds. So again, same sentence, right? No movement of the balanced leg, movement of the balanced leg, movement of the balanced leg fast. We are in the power level. Now, this is all about reactive joint stabilization. So you are learning how to stabilize your joints in a super explosive manner. Are you going to be doing these with senior clients? Probably not in most cases, but again, I will say, if they can do it, then do it. But you know, to be honest, a lot of them will probably, you're not going to get very many senior clients who are going to be great at balance power exercises. Now, balance power exercises are something that involves rapid eccentric decelerating of a joint. So you have to be explosive into a landing is what that means, right? So a frontal plane box hop up with stabilization. Whew, that's a long exercise name, right? So frontal plane means I'm going to jump like this, right? I'm going to jump because the frontal plane moves this way. So I'm going to jump either to the, you know, to one side or the other. Usually it's towards the side of whatever leg you're on. I don't have a box here, but what I'm going to do is I'm going to stand on one leg and I'm going to hop onto a box and then land. I'm going to hold that landing for 3 to 5 seconds. Then I'm going to step back down and do my next rep. Hop, 1, 2, 3, and do my next one, right? So that's the frontal plane hop with, oh, it doesn't say box hop. That is the frontal plane hop with stabilization. That actually was a perfect demo. Box hop up with stabilization, that's what I don't have. So if I had a box here and I were to jump onto it, right, that'd be the single leg box hop up with stabilization. Then there's also like the reverse lunge jump to stabilization, which would literally be do a reverse lunge, leap, and land. Reverse lunge, leap, and land. Don't take your hands off your hips. So that is, all of those are the power level balance exercises. So we're being explosive because it's power. But again, our priority that we're working on is balance, right? So every one of those involves a 2 to 3 sets of 8 to 12 repetitions. Hold your landing for 3 to 5 seconds. This is going to look really familiar in just a second. So that is balance stuff. Questions? Comments? Concerns?
Nope.
Feeling good?
Yep.
You're like, man, I've seen this a million times. I'm an expert at this point.
No, not really. Not really. The more you see it, the more you remember it, you know?
Right? That's the goal, man. Hopefully you're hearing it just, you know, that's the thing. That's why we like the senior stuff, is because like, that's why we have all the different like modules. It's because like, hopefully it's just a little bit of a curveball every time. Because it's like, well, with kids and with seniors and with weight loss and with, you know, athletes. All right, so our last little bit here, we've got the reactive or plyometric exercises. So these are exercises that focus on utilizing stretch shortening cycles, and they require the neuromuscular system to react to ground reaction forces. So plyometric exercises are all about training your nervous system to react to contact, right? That's reaction. Right, that is it's literally about your reaction time. These are also sometimes referred to as plyometric because they are explosive in nature, right? So just a quick review what a stretch shortening cycle is. Remember, your nervous system is arranged to protect your muscles. So when you rapidly lengthen a muscle, like when you rapidly stretch something out, right, your nervous system goes, whoa, that was really fast. And so it's like we got stretched way too quickly. So then what it does is it contracts in the opposite direction. That's why you kind of have that bounce in your muscles. When you rapidly stretch something, your body goes, no, and then it contracts back in the opposite direction, right? It rebounds. So it's a rapid eccentric lengthening that triggers a rapid concentric shortening. Your body goes, no, 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 and it pulls it back in the opposite direction. So that is one of the reasons why when I was saying about that medicine, those explosive movements, right? I want my client, I don't want them to just like toss it explosively and then like catch it and then like toss it explosively, right? I want them to be fast. I want them to go boom, right? Get it in, get it out. Rapid eccentric, that causes lengthening. My body goes, and then it contracts, and then I do rapid shortening. So that is that explosive nature that we are looking for. So if your client is, we're going to see 3 levels here. Same progression here. We are going to see plyometric stabilization, plyometric strength, and plyometric power. Now, you should only do any of these if your client has proper core strength and proper balance, and they can move through a full range of motion. If your client can't do any of those things, it's totally inappropriate to do reactive exercises, right? So make sure you're always basing that. And that can be literally anybody, by the way. It doesn't have to be a senior thing. It's just talking about seniors here. So what are reactive stabilization exercises? How can you be explosive and focus on not moving? Well, that's where plyometric stabilization comes in. So plyometric stabilization exercises are reactive exercises that involve little to no movement after you land. So they are all about focusing on teaching your client how to do landing mechanics. If you do end up doing reactive exercises with your seniors, they'll probably be reactive stabilization exercises. So this is why there's a difference between, I'm going to do a squat jump, which is this, and a squat jump to stabilization, which is this. Right? One is different than the other. Squat jump to stabilization. They are different exercises. Elephant, seal. 2 totally different animals, I got to get a different example of that. I need another animal that has 2 names. So those are plyometric stabilization exercises. You are going to do 1 to 3 sets. You're only doing 5 to 8 repetitions, but you are holding your landing 3 to 5 seconds. Really good examples include the box jump to stabilization. So if you jumped up onto a box and held your landing for 3 to 5 seconds, squat jump to stabilization, which is what I just did, or if you jump off of a box and land for 3 to 5 seconds. This is particularly my favorite with senior clients. It is relatively high impact, but I think it is also the most applicable to a lot of like senior situations. We are trying to get them to be able to go down the stairs for the rest of their lives, and descend. Now, reactive strength, this may be done with senior clients, although it's fairly uncommon. These are plyometric strength exercises, phases 2, 3, and 4. They are reactive exercises that involve a full range of motion, and they are performed at a repetitive tempo. So now you're starting to get into using those stretch shortening cycles. So again, squat jumps is a really good example, but this is different from a squat jump to stabilization. So both of these are squat jumps, right? I would squat and I would jump, but squat jump to stabilization looks like this. 1, 2, 3. 1, 2, 3, right? Whereas squat jumps in the strength level would look like this. Right? As soon as I'm done with one, I'm going into the next. You'll notice you'll get a little rhythm with these. These often have just a little bit of like a tempo to them. That's why we call this a repeating tempo. And so it's just like one right into the next. You're getting a stretch, shorten, stretch, shorten, stretch, shorten, right? You get a little rhythm. So you are sort of working on that stretch shortening cycle, but you're not doing it at like a super maximal intensity or anything like that. That is where the power level comes in. So power level develops high level of dynamic neuromuscular efficiency. So this is really cool because this is all about recruiting the right muscle at the right time, but it also has reactive joint stabilization. So you're focusing on stabilizing your joints explosively as they transfer from eccentric to concentric. So these are reactive exercises that utilize a maximal rate of force production and a full eccentric range of motion. So eccentric concentric. So 2 to 3 sets, 8 to 12. Here, look at this tempo. Not a repeating tempo. As fast as possible tempo. So here's the thing. Squat jumps suddenly, they kind of become obsolete in the reactive power level because you cannot do rapid eccentric deceleration. You can't force yourself from one rep to the next. So I want to show you the power step up. So here's a power step up. See how she is alternating from one leg to the next? The faster she does one repetition, the faster she can do the next one. That's what makes it a power reactive exercise. The faster she does her left, the faster she can do her right. By the way, really quickly, look at her landing mechanics. Watch her ankles. See how like she's planting, she's doing a little bit of extra plantar flexion, like actually we'll slow down even more. Watch the little bit of extra plantar flexion that happens. Like there's plantar flexion already, but watch this right as she's about to get to the ground. Oh, hold on. See how it does that little extra toe flex, like that little bit of extra just right at the end? That is her nervous system going, where's the ground? You know, like it's reaching for it. That's why this is reactive. She's literally, you know, we're watching this in slow motion. We're watching her nervous system react at super, super fast speed. We also really like ice skaters performed explosively as possible. The faster you do your left, the faster you can do your right. Boom, 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 right? So that's what makes reactive, that's what makes something reactive power. Reactive strength is pretty explosive. Reactive power is super explosive. So power step-ups, ice skaters, or proprioceptive plyometrics. Actually, if you think of the shark skill test, right? Let's say I was doing the sharks test, but I was just doing jumping with 2 feet, right? The faster I jump with one, the faster I can jump with the other, right? High knees, right? The faster I do one, the faster I can do the other. That is plyometric power, right? It's like, hey, I heard you liked power, so I got you some power to go with your power. It's super explosive. All right, so safety guidelines, always begin with the sagittal plane, then work your way into the frontal plane, then work your way into the transverse. So if I had a brand new client, I would work on planks and prone cobras, then I would work on side planks, and then eventually I can maybe get into like that Pavlov press, which is a little bit of that twist, right? Always take precaution with your senior clients whenever they're backwards stepping. Actually, backwards stepping is one of the things I will often use that as an exercise with my senior clients. And so they'll literally just walk backwards, and I have to learn how to walk toe to heel, and they have to learn how to not do like a shuffle. They are taking confident steps. I will often use that as like a balance exercise for my senior clients, where they'll even like step like this. You always want to be there behind your clients and make sure that you can catch them if they do struggle. But it is a great exercise to keep them nice and upright for years and years and years. Always have balance assistance when available. Kind of just talked about that. And then you can always decrease your amplitude. Doesn't have to be super high jumps, right? Little bits of motion can be enough. So biggest concerns here when you're writing a program for a senior client, you are trying to avoid falling. You're trying to build them up to get them to be fall proof. A lot of times that falling is going to be due to like a loss of neuromuscular efficiency. They're going to lose the ability to recruit the right muscle at the right time. So then, you know, that muscle might be late to the party and then it doesn't contract. You've probably experienced this if you've ever jumped out of a tree or something and all of a sudden you just crumpled instead of actually sticking the landing. That's usually due to a miscommunication in your nervous system, or it's your nervous system just going, I'm out, too much stimulus. But the nice thing is all this movement prep stuff, core balance and reactive training has really positive effects. Any questions about that before we kind of whip up a program?
Nope.
Cool, cool. All right. Where's my thing? Okay. So we're back to Bob. You remember Bob? Last time we built Bob his warm-up, he was in phase 1, so we were doing corrective flexibility. Well, guess what? Bob's got the same warm-up. Nothing fancy there. All we're doing is adding to this. So now we are going to pick one core exercise, one balance, and one reactive, but it is going to be in phase 1. So that's going to be a core stabilization, balance stabilization, and reactive stabilization exercise. So we decided to go with the plank because, you know, it's a classic. We did do this for 30 seconds, by the way. For the record, you can totally do planks for repetitions. You just do like a 2-second hold, relaxed, 2-second hold, relax, 2-second hold, relax. I don't usually do that with my senior clients just because it involves a lot of times, no matter how much I coach them to, they bang their knees on the ground in between reps. And I'm always just like, hey, don't bang your knees, be really gentle. And then just like, wham, and you're like, so I will often just do the isometric version. Single leg balance with reach, we went 6 each, right? So that's going to be, and then we chose to do the frontal and the transverse versions here. So they're going to go 1, 2. I don't particularly like doing the sagittal one that often because it's hip flexion. It's like, who needs more hip flexion? Hashtag nobody. And then we have the squat jump to stabilization, right? So he's going to do a transverse squat jump to stabilization, which means he's going to do a little 90-degree turn because transverse means to rotate, right? So he's going to do a little jump, 1, 2, 3, and then land, right? And that's sort of what we're looking there. We're doing 3 repetitions each for a total of 6 because we're supposed to do between 5 and 8. We went with 3 each because then, you know, he can turn 3 times this way and 3 times that way. And we got him somewhere in the middle. And that's the stabilization routine. Next month, Bob is going to be in phase 2, so we're putting him into the strength routine. So now we're going to do core strength, balance strength, and reactive strength. We did not move his core. We did not move his balance leg, and we did not move upon landing, but now we're gonna. So we're gonna do that stability ball crunch. So he's gonna move his spine through a full range of motion for 10 repetitions. We're gonna have him do that single leg Romanian deadlift. So he's gonna go down and hinge and then come right back up for 10 repetitions each this time. That's a pretty big jump, by the way, but it is a big jump. And then we're going to do repeat transverse squat jump. So he's actually going to go 5 each this time for a total of 10 reps. And I want him jumping back and forth. So he's going to squat. 1, 2, and he's going to do 5 each of those. By the way, you can also have him do a full 180. I actually really like, I used to do this. I used to do an Avengers themed workout and I would call it, I called them Captain Americans, and it was like, you got to duck behind your shield. And so you would duck and then you would jump and duck and you have to flip the shield back and forth. There's a really fun kids themed workout that adults liked too. So that's phase 2. Then we got our client in level 3 here. So this is phase 5. So this is going to be the core power, balance power, reactive power. That is going to be a medicine ball pull over throw. So he's back on that stability ball, but this time he's got a medicine ball in hand. He's going to crunch super explosively. He's going to do the single leg RDL jump to stabilization. That is a mouthful. But he is going to go down into an RDL. When he comes up, he's going to jump, hold that landing for 3 to 5 seconds, and reset. Okay? And then he's going to do proprioceptive plyometrics. You're going to have a cone, and he's going to jump those just like this. The faster he does one, the faster he can do the other. I can also do single leg proprioceptive plyometrics, right? It's all about being explosive. And that's that. Do you have any questions, Robert? How you feeling?
Good. I feel pretty good. Have you ever experienced with any of your senior clients, like getting them to the power levels of anything?
Oh, sure. Yeah, absolutely.
Oh, okay.
Like I said, Al Jubitz, man, he was in his 70s, loved burpees. Love. I think he loved them because of all of us just being like, you know, like, how?
Like he was a show off, or he liked showing off?
Yeah, man, he did. His wife was in really good shape too. Man, she had this like super intense fall. She fell from like because Oregon's so, you know, rainy and stuff, there's a lot of like retaining wall. Like a lot of houses are built on retaining walls. So you'll have like you know, your yard will start at like eye level. And so you go up like some concrete stairs. So she like fell off one of those. And totally bounced back and, you know, hit the gym. It was crazy. Both of them seniors, you know. She wasn't as intense as Al. Al was a freak of nature. I should say is. I'm sure he's, you know, still up there hitting the same gym. But yeah, you'll definitely run into it. It's just rare. But yeah, any other questions, man? You feeling good?
Feeling good. We got homework tonight, right?
No. Homework was on Friday, I think.
Oh yeah, that's right. Yeah, so homework tomorrow.
Yep. So tomorrow will be like the resistance section plus movement prep.
Yeah.
So that'll actually be easy because that'll really spread the questions out. I assume, at least. I do not have them memorized. All right, man. Well, I'm going to let you go. Those of you watching the recording, knock it out, and I will see all y'all tomorrow.